Zap zap! Time to get shocked!
Let's talk about electroconvulsive therapy, or ECT. Let's clear up the myths and focus on what you absolutely need to know. First off, what is ECT? It's a safe and highly effective medical procedure for specific, severe psychiatric conditions. The key here is that it's done under general anesthesia, where a brief, controlled seizure is induced to provide a therapeutic effect. So, when do we use it? The number one indication is major depressive disorder with severe features. Think about a patient who is treatment-resistant, meaning they've failed multiple antidepressant trials, or maybe they have psychotic features like delusions. Most importantly, think of emergencies. If a patient is severely suicidal, refusing to eat or drink, or is catatonic, ECT can be life-saving because it works fast. Speaking of catatonia, ECT is actually a first-line treatment for it. It is also used for severe manic or depressive episodes in bipolar disorder that aren't responding to medication. How does it work? Well, we don't know. It's thought to reset the brain's chemistry, changing neurotransmitter levels like serotonin and dopamine and promoting neuroplasticity. The seizure itself is what's therapeutic. During the procedure, the patient gets a short-acting anesthetic and a muscle relaxant. This is important they don't convulse on the table. Electrodes on the scalp deliver a small current, inducing a seizure that lasts about 30 to 60 seconds, which we monitor on an EEG. Now, for the side effects, another favorite exam question. The most common and most feared is memory loss, both anterograde and retrograde. This is usually temporary, but some memory loss around the time of the treatment can persist. Using unilateral electrode placement can help reduce this. Patients also commonly experience headache, nausea, and muscle aches right after the procedure. Also, be aware of the cardiovascular effects, a brief moment of bradycardia, followed by tachycardia and hypertension during the seizure. What about contraindications? This is a trick question. There are nitrogen monoxide absolute contraindications to ECT. However, there are relative ones. The biggest one to watch out for is increased intracranial pressure, like from a brain tumor, because the seizure can make it worse. But what about pregnancy? Is it a contraindication? No. In fact, ECT is considered one of the safest treatments for severe depression during pregnancy because it avoids exposing the fetus to medications. So, let's recap. 1. Know the emergency indications like suicidality, catatonia, and treatment-resistant depression. 2. The most common side effect is temporary memory loss. 3. There are no absolute contraindications, but be cautious with increased intracranial pressure. And 4. ECT is safe in pregnancy. That's it for ECT. Keep grinding.